Hello everybody, I'm Helen. I'm the Hepatitis C nurse specialist and I used to work in Courtyard Clinic as well, and I'll come to talk to you today about HIV, your liver, and a little bit about Hepatitis C. So I guess why do we think liver health is important for people living with HIV? Well, actually after AIDS, liver disease is the second leading cause of death in people with HIV, and in fact in their general population it's the biggest cause of death as well. So things like heart disease and cancers, the death rates have remained stable, but the rates of deaths from liver disease have increased enormously. So it's really important that we look after our livers. So I'm not going to really go through the whole list of what your liver does, but just to say that it does lots of things. I'm going to put my glasses on so I can read this going. So it processes your food, it breaks down food to make it into energy, it stores iron and vitamins and other chemicals, it controls your fat levels, it combats infections, it cleans your blood of particles and infections, it manufactures lots of hormones, including sex hormones, and it makes enzymes and proteins which are responsible for clotting your blood and repairing damaged tissue. So your liver does a lot of things. And if you think about your heart, all your heart does is pump blood around your body, or your kidneys do a filter your urine, but actually the liver does a lot of things. So basically, if you have a sick liver, then you will feel sick yourself. Okay, so this is quite an extreme slide here, but actually if your liver is very damaged, your skin will go bright yellow, you'll lose your hair, you'll get a big fat belly, you get itchy skin. So it's actually a sick liver isn't a good thing. And the thing about the liver is it can actually, it's very good at repairing itself, but when it's completely damaged then it can't repair itself anymore. So hepatitis, probably people have heard that expression, means that the liver has become inflamed. And there are lots of reasons why the liver has become inflamed, but I've put the two biggest reasons on this slide. The main reason, which might surprise you, is fat. And basically, as people have got fatter, and in general population, their livers are getting fatter too. So the fat that's excessive gets stored into your liver, and when it gets stored into your liver it gets very hard and it blocks the liver up and it can cause inflammation. So fat's a really important thing. Alcohol is another thing. Otherwise, recreational drugs can cause inflammation with your liver, so can some medications, and I put very small on there, autoimmune disease, but also infections can cause it. You've probably heard of things like Hepatitis A, Hepatitis B, Hepatitis C, so they can also cause inflammation. And very often you won't know that your liver's inflamed or has hepatitis or that you've got a problem with it, and it usually just shows up on one of the basic liver tests that you have at the clinic. So you might not feel that you've got a problem with your liver until you have the tests done. So basically your liver is meant to be nice and smooth. I don't know if many people buy liver to eat anymore, but it's meant all sort of floppy and red. That's how it should look. So that's a healthy liver on the slide with all the smooth edges. Now, as the liver gets more and more damaged, either that's by too much fat, too much alcohol, or an infection like hepatitis A, B, and C, it develops what we call fibrosis, so it gets stiffer, and eventually it gets so stiff it becomes bubbly and full of nodules, which means the blood can't flow through it properly and your liver doesn't function at all. And then eventually, if you get cirrhosis, you can get end-stage liver disease, or you can develop cancer as well. So those pictures show that. So there's a picture of a cartoon picture, and then there's a picture of actually in real life liver at the top there for you. So actually it doesn't look very pretty. So how can you protect your liver? Well, one of the main things you can do is about moderating your alcohol intake. And men and women are advised not to regularly drink more than 14 units a week. Now, it used to be that men could drink 21 and women could drink 14, but they've changed the recommendations now, so it's the same for both genders. And they suggest that you spread your drinking out over 3 days or more if you drink 14 units a week, so don't save it all up for Friday or Saturday night. And actually, if you look at the pictures at the bottom, it's surprising how many units there are in a drink. So, for example, just a small glass of wine is 2.3 units, a pint of beer is 2.6. So actually, there's quite a few units in each drink. So not one drink is 1 unit, if you know what I mean. So you need to moderate your alcohol intake. You also need to protect your liver to reduce the amount of fat that's in your body. So it's the basic things really. It's losing weight, choosing a healthy diet, having more exercise and being more active. If you have diabetes, make sure it's under control, and make sure that your cholesterol levels are within a normal range. And if you do have a fatty liver and you're diagnosed with a fatty liver, it's not the end of the world. If you lose weight and have a healthy diet, then your liver can recover. But there is some good news, okay? So in the past decade, results from studies suggest that regular coffee consumption seems to benefit the liver, and daily consumption of coffee and chocolate is associated with having normal liver enzymes in your blood with people who have HIV and hepatitis C. And I've been to some very high-ranking talks about hepatitis, and this is true. So drinking 3 cups of coffee a day can actually protect your liver. So we're recommending that for people who have hepatitis C. So coffee and chocolate is good. So the other way you can protect your liver is prevent yourself from getting the infections, hepatitis A and B. So everybody with HIV should be checked for hepatitis B, and if you're not immune, you should be offered a vaccination against hepatitis B. This is a course of 3 or 4 injections. Hepatitis A is spread in a slightly different way to hepatitis B. Hepatitis B is spread through blood, but hepatitis A is spread through through food and drink and contaminated water. We call it the fecal-oral route, so basically poo that gets into the food. Now, at the moment, there's an outbreak of hepatitis A amongst men who have sex with men, so it's really important if you're a man who has sex with men that you talk to your doctor about being vaccinated against hepatitis A. And just to mention, and I'll talk about hepatitis C a little bit more in a moment, is there's actually no vaccine against hepatitis C, which is one of the main causes of hepatitis in people living with HIV. So to protect yourself, you need to have safer sex, avoid sharing needles and drug and injecting equipment, and not share razors and toothbrushes. But later on in the talk, I'll give you a bit more information about that. So let's just get on to hepatitis C, which is meant to be the main subject of my talk. So what is hepatitis C? Well, hepatitis C is sometimes called Hep C or HCV, and it's a virus that's carried in the blood which infects and damages the liver. The hepatitis C virus infects the cells in your liver, causing it inflammation, which is swelling and tenderness, and fibrosis, which is that damage that I showed you in those pictures earlier. In people with chronic long-term hepatitis C, the inflammation and fibrosis continue to spread, and it can develop into cirrhosis. So how do you get hepatitis C? Well, I've done an arrow down the side. The top one is the most common and the bottom one the less common. So in the UK, we usually see hepatitis C amongst people who've used IV drugs either in the past or currently. Now actually, even if you've injected drugs once or twice, you can have hepatitis C. So we have quite a few people who were part of the hippie generation who injected once in the 60s and 70s, and they have hepatitis C. So it doesn't have to be a long-term, ongoing habit. You can get it just from one injection. You can get it through chemsex, so that's the use of crystal meth or GBL, and it can be passed on during those kind of sex parties. Snorting cocaine is a way of passing it on, because if you damage your nose when you're snorting cocaine and you pass it on to somebody else, Hep C can be passed that way with little bits of blood on that. A lot of people got hepatitis C through receiving contaminated blood products. So people with haemophilia, for example, they have hepatitis C. And also in my clinic in the hepatitis service, I see a lot of people who live in Pakistan, and which is a very high prevalence country, as is Egypt. So they get that through their healthcare system. I put snorting cocaine twice, I won't just say that again. Tattoos and piercing, especially if the things aren't being sterilised properly. Through anal sex. There's just been a few papers written recently. We used to think men who had sex with men got hepatitis C because there was blood contamination, but we actually know now it can be passed on through anal sex without any blood contamination. Very rarely it's mother-to-child transmission, and some people can acquire it through household contact. The thing about hepatitis C is it can stay active outside the body for quite a few hours or even weeks afterwards, so it can live on razors and toothbrushes and that kind of thing. And if they get shared, then you can catch hepatitis C that way. And it's quite rare, but you can catch Hep C through vaginal sex, but that is quite rare. So what happens when you catch Hep C or someone catches hepatitis C? Well, very few people will get an acute, what we call an acute hepatitis C, where they feel very unwell, their skin goes yellow, they had a fever and they feel very, very unwell. But most people get infected a bit like HIV and don't really realise that they've been infected until they have a blood test. Now, approximately 20% of people who catch hepatitis C will clear the virus naturally themselves. So what happens if someone's diagnosed with hepatitis C and we know that it's a new infection? What we do is monitor them for 6 months to see if they get rid of the virus themselves before we would consider starting them on treatment. Most people will, however, 80% will develop chronic disease, and it's usually quite slow to progress. Some people will get fibrosis, some will get cirrhosis, and some will go on to get liver cancer, but that's not everybody. A lot of people with hepatitis C will not even know they've had it and die of something completely different. But the thing is, if you're older, if you're a man, if you drink alcohol, and if you're immune suppressed, disease can progress much more quickly. And we know that people with HIV and hepatitis C have a faster disease progression than people who don't have HIV. And I think something that people don't really talk about very often is the fact that although hepatitis C infects the liver, it can actually cause quite a few other problems for people. So it can cause a lot of fatigue, poor concentration. People say they have this kind of brain fog that they can't get rid of. They can have muscle pains, they have anxiety and mood swings. So what I found is a lot of people, when they start treatment for hepatitis C, will suddenly lose these kind of symptoms. So how do we diagnose and monitor hepatitis C? Well, if you're an HIV patient at the courtyard clinic, when you first came to see us, we would have done a set of baseline bloods, and part of that is a hepatitis C, what we call antibody test. So that will show us whether you've ever been in contact with hepatitis C. It won't tell us whether you've cleared it yourself or you've still got active infection. So if anyone's got a hepatitis C antibody positive, then we go on to test the blood for the virus itself. If we find the virus itself, then we know that you have infection, you haven't cleared it yourself. And it's really important then that we find out what kind of strain of hepatitis C you have. As you can see there are 6 different genotypes, and each genotype is treated in a slightly different way. So we use different drugs for different genotypes, so that's why it's important that we know that. We also test how your liver is working, and they're called liver function tests. Now, basically, if your liver's under stress and it's being damaged in any way, it releases enzymes, and we measure these enzymes in the blood. So the higher the enzymes are, the more damage is happening to your liver. And when I mentioned before that all the functions of the liver, well, the liver does make things in your blood that helps your blood clot. So if your liver's being very damaged, then your clotting factors aren't great. So we check your clotting. We also do an ultrasound like you do when you have a baby, and just looks at that. But also one of the other things we do is use a fibroscanner. A fibroscanner is really good because back in the olden days, if we wanted to check how your liver was, we'd have to put a big needle into your liver, called a liver biopsy, and take a core of liver out, which was very painful and actually quite dangerous because the liver is very vascular, it's full of blood, so a lot of people bled afterwards. But this fibroscanner is just like a little kick inside of your liver, and it shows us how wobbly or how stiff your liver is. So what you really want is a wobbly liver, but the stiffer your liver is on the fibroscan, the more damage that will have been done. So that's how we monitor you for hepatitis C. So just to say that if you're a man who has sex with men, then we will monitor your hepatitis C antibodies every year or 6 months. If you don't fit into that group and you're not injecting drugs, then we will only do that as a one-off. But obviously, if we do your blood tests and your liver function tests have got worse, or there's been a rise in those enzymes, then we probably would check for hepatitis C. So, the really good news is that the treatment of hepatitis C has improved no end in the last year to 18 months, hence my move to hepatitis C to help them treat all these patients. So before, all the treatment was 6 months to a year of weekly injections with interferon plus 3 tablets twice a day of a drug called ribavirin, which was very, very toxic, and it was very difficult to cope with the treatment. And it only had like a 50 to 60% success rate. So you not go through this year of hell and then you'll be cured. But now we can treat people with hepatitis C with 12 weeks of 1 tablet once a day. There are very, very few side effects. and you have to come to hospital every 2 to 4 weeks just for monitoring when you're having the treatment. And with most people, there's a 95 to 98% cure rate. And what's really good news for people living with HIV is actually the cure rates are exactly the same whether you have HIV or not. So the treatment works just as well if you have HIV, which is good news. Now the bad news is this treatment is expensive, very expensive. When we first started treating people with these drugs, they were costing £40,000 for a 3-month course of treatment. They're a little bit cheaper now, but they're still expensive. The other thing it doesn't do is it doesn't prevent reinfection. So if you've had hepatitis C and you've cleared it yourself, or you've had hepatitis C treatment and you've cleared it, it doesn't mean you can't catch hepatitis C again. You don't get any immunity, which is really important. So unfortunately, because they're so expensive, we discuss each case, and then if you offer treatment and you take it, then and you don't take it properly, or you get reinfected, then that's your one chance at treatment, and you go back to the bottom of the list. There are some interactions with HIV medication, so if you do need treatment for hepatitis C, it might mean you need to change your HIV drugs for a little while, but that's fine, that's manageable. And a bit like the very early HIV drugs, you really do need 100% adherence to success with this treatment. If you miss a couple of doses, it's not going to work, so and you can develop drug resistance. So good news and bad news. So I guess it's really important if you have been treated for hepatitis C, not to catch hepatitis C, and then maybe not to catch hepatitis C in the first place. So as I said to you before, there's no vaccine and there's no immunity after you clear the virus yourself or through treatment. So it's really important if you do inject drugs or you're using crystal meth or whatever, that you don't share, or you're snorting cocaine, that you don't share any drug paraphernalia, that you keep your own to yourself. It's really important that you don't share sex toys, or you make sure that they're clean, or use condoms on them between use. I guess the only real way to protect yourself is through safer sex and use of condoms, reducing the number of sexual partners, trying to avoid rough sex and fisting, and at the bottom, don't share razors and toothbrushes. So it's really important to try and avoid reinfection. So really my take-home messages are that you really need to look after your liver. You've only got one, and if you've got an unhealthy liver, you'll feel bad yourself, so really look after it. So the main things are to keep to a healthy diet, maintain a healthy weight and get some exercise, have alcohol in moderation, make sure that you've been vaccinated against hepatitis B and hepatitis A if you're a man who has sex with men. Also, the other thing which I didn't really mention is some of the medications that we give you can have an effect on your liver, and also if you take them with other drugs, they can have an effect on your liver. So if you are on antiretroviral therapy and you need to be prescribed anything else, or you want to take anything else over the counter, then do check with the pharmacy to make sure that they're not going to cause problems with your liver in the future. Try and avoid contracting Hep C and get tested if you think you're at risk. Thank you.